Hi, and good afternoon, or maybe good morning, since this is a virtual recording. Not sure what time of the day you might be watching or what part of the country you might be coming in electronically from. But it is always such an honor and privilege to have the chance and opportunity to speak and provide education for AUA members. I was just telling Laura I've been part of the faculty now for over 20 years, and I truly get more out of participating and sharing knowledge, and it does not get missed on me how much that I enjoy doing this. So just want to start by saying thank you again for the privilege of providing education. And so today, on behalf of the 2004 Institute for Leadership and Business track, we're going to be talking about the topic of artificial intelligence, which I'm sure you've heard a lot about recently and have been probably hearing both good and bad, maybe even some unsettling things. And so we're going to try to cover this not only at a high level, but then we're going to get down to some specifics. And then more specifically, we'll end on how should you respond, and what would be a path forward for those practices that are either whether you're curious or ready to start adopting AI for your practice. So with that being said, the agenda today, we'll just kind of briefly do an overview, some history of what AI has looked like. We'll look at it then more specifically in operations, and then we'll touch on some of the the ethical and legal considerations of AI. Full disclosure, which I should have said the slide previously, we do not have any financial conflicts with any vendors or products or any AI companies, and no other conflicts to report other than just providing guidance and education. So sorry, I forgot to mention that a second ago. But when I hit the second to the last bullet, it reminded me that I should have given that disclaimer. So now that we got that out of the way, let's get into the presentation itself. All right. So what is intelligence? Obviously, it's the ability to think and acquire, right, for yourself. The ability to interact, have speech, motion, grab things, the ability to reason, sometimes maybe if you're my kids, argue a little bit, the ability to learn and adapt, and then to think in an abstract way. You notice I didn't put, at least I should have probably put on here, which is something that I think, on a personal level, I often think about conscience and where does that come from, right? That's always a question that's still to this day is oftentimes studied and talked about. And the one thing that I've oftentimes said to myself is that I will get really terrified if AI can develop a conscience. Some people think it can. I don't think it's possible, but that's where I think we would perhaps maybe cross the line a little bit, or it could get extremely interesting. But I should have probably put that as part of our intelligence. It's definitely something that has always been something I've been curious about. Exactly where does conscience come from, right? And so this is kind of how we define it, I guess. And then when you start thinking about how does that then translate to artificial intelligence, the word artificial intelligence, or those two words actually, is kind of the umbrella term for what we refer to as machine learning, or the capability of machines to process information in a way that's very similar to how our brains might work. And then within artificial intelligence, there's two mechanisms. There's what's called machine learning, which is primarily most of what you see today. And then there's the deep level of learning. This is when the machine actually has the capability of evolving and perhaps even thinking on their own beyond their intended use. Very rarely do we see that in any applications that I'm aware of. I know it does exist, and there's a lot of discussions about that. But most of the innovators today are attempting to cap their AI to just its purpose for the algorithms that's for an intended specific purpose, not necessarily to continue to learn and grow in intelligence. By the numbers, dramatically growing, right? I mean, this is a little bit outdated. I couldn't find anything that had more recent years, and it could be because the startups, take a while to get funding and go to market and then become known. But there's no doubt, and you've seen it everywhere and hear about it, that there's a lot of innovators rushing in and starting AI companies. I think towards the end you'll see a number of them that have come up just recently, and in many ways this is probably going to be bigger than it was 10, 15, 20 years ago remember when all the EHR vendors rushed in and they all thought they had the best solution. And, today, as oftentimes is the case, a lot of innovators rush in and then the market consolidates and then two or three major players will then emerge as the primary players. So we don't quite yet know who that is quite yet, but we do know there's a lot of innovators obviously chasing it. Also, if you look at the size that they're predicting, the venture capitalists, this is oftentimes kind of the canary in the coal mine. Where are people actually putting their money and how much money are they putting into it? It's already well into the billions, maybe even the trillions at this point. And it's just, again, expected to continue to increase. So it's here. I think that, it would be somewhat naive to think that it's just going to be a fad. I actually think it's probably around more often than we realize it. In which we'll get into some theories here in a minute about facial recognition, speech recognition. The whole thought is, do our phones listen to us? I'm not a conspiracy person, but I actually think the phones, in fact, I know the phones pick up on ambient listening, and there's evidence that even in logs in your in the back ends of some of these applications that actually record the information they're picking up through our conversations. And in fact, one of the hot trends now is ambient listening in the exam room while a patient and doctor's having the conversation, which we'll get into later. Again, by the numbers, the job market is also chasing this, and the salaries are pretty significant. I mean, they're pushing well into the six figures, and in some cases, they're climbing, even much higher. Depending on your skills, but people oftentimes think about AI eliminating jobs. I actually do think it will eliminate, unfortunately, a lot of low skill jobs, but I also think it could create a lot of opportunities for people that obviously want to grow and learn new skills. Additional numbers here, the revenue being generated from this. This is probably hard to really pin down because, you hear big numbers, but are they making money? How are they monetizing it? Things like ChatGPT and other products that are out there. My guess is they're probably, as we feed it information, there's probably really smart people in the back end that's figuring out how to monetize that. You probably remember the Netflix special where the tagline was, if you're not paying for the product, you probably are the product, right? So we do know that these social media platforms and data platforms aggregate a large amount of information on us. In fact, there's a company called LexisNexis that apparently has something like 3,000 to 5,000 unique data elements on each and every one of us. Everything from where we like to vacation, how much we spend on Amazon, what do we buy on Amazon, our political affiliations, everything that you can think of, they're tracking that. And that's one of the reasons why everything on the internet is so personalized. It's no accident that you get information fed to you based on your unique interests or perhaps your digital history. So I do believe that, these companies are generating and will be generating revenue from leveraging AI and the information they collect on us. In urology, what we're seeing more than, and we're going to get into some operational examples, but I don't have any specific, like what I would call business office or operational unique to urology. But what we did discover is that urology always has been, in my opinion, one of the innovating specialties way out ahead of everyone else. Remember the robotics and the Da Vinci and things akin to that. A lot of the advanced imaging to track and try to detect early diseases. So this was from Quintip, which is tracking where some of the investments are going. And you can see, no surprise, a lot of it is actually centered on diagnosing urological issues and diseases. And a lot of that is focused on images, diagnostic images, so early detection. And it's the computers aren't outperforming by a lot, but by about 2%, they're actually picking up, having better odds of detecting early disease than most radiologists can. Now, that's not necessarily the urologist that's doing that work, but clearly the urologist is depending on those early diagnoses, and they have a high degree of interest in trying to have better outcomes by detecting early. And there's a couple others that's actually focusing on kidney stones, and so I think it's definitely more prevalent in our clinical side of the practice than it is operations. A few predictions. Obviously, some of these have been around for a minute, but I do believe that the job loss is for the low skill jobs. That's a real number, and I think the areas that's probably most at risk as it relates to medical practices, I believe your help desk ticketing system. So, my industry, right? Like we help people fix computers. Well, what happens when the chatbot is doing a better job? In fact, a lot of the chatbots now and IT managed support can actually go in and repair problems that happen in the middle of the night before we even come in the office. It's already fixed it. Think of these, password resets where you just put a token in and it issues a new password. That's all being done by robots now. You have insider threat monitoring tools that's looking at your network, and all of a sudden it saw activity occurring at 3 o'clock in the morning on one of your employees' computers, and that employee the next morning said, "No, I was sleeping at that time." Or you're getting emails from that employee who never sends an email after 5 o'clock, and that looks suspicious. So there are these tools that's starting to monitor things. We've seen the generation that's coming into the workforce, good or bad. I know we have lots of opinions on this, but they are very much driven through tools and apps and in fact just communicating with them. Sometimes I have my kid, I have one that's 13 and one that's 29, and I have much better odds getting communications going through electronic forms than I ever would. They're not going to answer my phone call if I try to call them, but I can text them usually. So a lot of changes is happening, and I do believe these predictions are likely going to come true. A little bit of timeline just for fun. If you kind of go through the history of evolution, I thought there was my little. We must have had to remove it because the size. But I remember the Microsoft guy that used to click on your monitor that had the little paper clip, and that was sort of an early form. One of the probably ones that I remember my first instance of seeing it actually appear in my work life was these editing tools that would just automatically find problems with documents and then would start making suggestions. So that was some of the early examples. IBM made some pretty big accomplishments when they actually built a machine called Deep Blue that was able to actually beat the world champion chess player. And if you think about playing chess, if you ever done that before, know how to play chess, you have to be thinking 4, 5, 6 moves down to be an effective chess player, especially the world champion of all things. You've had Google and others, and of course the timeline. I didn't really do current because I kind of wanted you to see that this has been, people have been chasing artificial intelligence for some time now, going all the way back to 1956. Again, IBM, innovating some technology there. So we've been at it for a minute, and a lot of companies, big companies, have been chasing this. Other stats that come into play that you see in the market, one being Netflix is driving a lot of their content. Think about how do they know? I mean, like, they're really good at picking the shows, right, that we like. That's not by accident, because if you have your house profile set up, you can see that, in my wife's case, they're pushing her all the Lifetime movies, and I'm getting all the war documentaries, and it's interesting because it's the same TV, the same internet connection, but somehow they figured out our two preferences, and they basically have sourced that data, and that's all, from what I understand, not being done by humans. It's just the computers and the robots watching our activity and then feeding us back information. Gartner's another company that tracks this. They predict by that 85% will be using some sort of having some sort of interaction, and I think that's probably higher today because I tell my kids what it used to be like traveling, and you actually had to get a map out. Right nowadays, I don't even think about where the next turn is until I pass the turn in some cases, or a few seconds before I get to the turn. So now we have these apps that can figure out. In fact, the scary thing is, have you ever had this happen where your phone actually alerts you that, hey, you better leave now to go to a meeting because it already knows that traffic is starting to pile up. So it's telling you to leave early. Like, A, it knows where you're going. B, it knows that traffic, and it already sort of knows the routes that you're going to take. They're also predicting that while we talked about a loss in jobs, we're also seeing an increase in jobs as well too. So I think it's going to be a trade-off as it relates to sort of winners and losers in the job market. Now let's transition a little bit and get into some examples in healthcare, because I think this is really where it gets a little bit more applicable to our jobs. One of the areas that AI, that I personally have been extremely excited to see, is its ability to fight and detect and prevent infections. I'm not sure if you guys are aware of this stat or not, but over 200,000 people, healthy people, like go into hospitals for routine procedures and never come out. That is the equivalent of a 747 crashing every single day. I don't think we realize how dangerous hospitals can be sometimes when you're dealing with these infections. And there's now artificial intelligence. In fact, this next device here, and you could even see this in clinics, this little badge is detecting if the nurse or caregiver went between patients' rooms without first clearing a wash station to sanitize before they went to the next patient. It doesn't mean you cannot, just walk past it and trip the sensor, but little things like this, because I think in a busy hospital, what oftentimes happens is you're under so much pressure to care for so many patients on that floor. You can easily see how even the best of person with the best of hygiene just simply forgets, right? Or they weren't aware that they just left one room and they're entering another room. So that's just one example of how these devices are now tracking and helping caretakers reduce infections. Another example that's not necessarily, well, it's in line with what we're kind of seeing around telehealth, but this is taking it to another level. These are actual virtual assistants that are carrying out tasks in some cases. In behavioral health, we actually have virtual assistants that check in on patients. Did you take your meds? How are you feeling today? In fact, my watch, the Apple Watch, has a little chat bot that checks on me to see if to make sure I'm standing up, or did you drink your water? And that these tools are now being linked back to caregivers, so that way, if you're managing a chronic condition, you too can have these sort of virtual assistants that you may have otherwise had to have a nurse or someone calling and reminding patients to do certain things. So we're starting to see these virtual bots show up and starting to interact more directly with consumers, so patient-facing type assistants. This is an example of a little bot that actually travels around the hospital. This is out in Belgium, but I've seen these not as cute as this one, but Centera has one. In fact, Dr. Steve Schlossberg, who's a member of AUA, was one of the pioneers that actually brought that to the hospital, because he was complaining that, hey, every time I have to leave my office to go to the hospital, I have to cancel, 5 or 6 patients. It's costing me a lot of money. And so one of the things that he was able to get Centera to do is they bought this robot that had this monitor, and he would actually drive it around the hospital with a joystick from his office across town, and could literally go into the hospital room, do a consult. Right there in the monitor was Dr. Schlossberg, and the conversation was occurring just as if he was bedside. So, again, I don't necessarily think this is full AI. It's, we've had robots roaming around hospitals delivering supplies for some time now, but the fact that some of these bots do interact without a person driving it with the joystick. They can go and have conversations with patients. This one is not necessarily doing anything clinical. It's just acting as the greeter. So when you walk into the hospital, if you need help getting somewhere, maybe you're looking for the cafeteria, it can actually walk you or escort you there. It helps sign papers and things akin to check patients in. So think of your front desk in the near future being a bot at some point. One of the very first, this isn't applicable to urology, but it's worth noting that our friends over in ophthalmology actually successfully got the very first FDA AI imaging device that went to market. So they kind of broke the ground in getting FDA approval. And since then, all the other specialties have kind of started, also adopting the same thing, specifically in urology. So in most cases, as I mentioned earlier, you're seeing that AI is really focusing in on the diagnostic imaging, early detection, looking at the tumor size, tumor grading, things akin to that. And then we did find some evidence that it was also using it to not only detect kidney stones, but to classify them to a better degree of accuracy. I make kidney stones. I'm not proud of that, but I've actually had them missed before, and by the hospital radiologist and the urologist, which is something that frustrates a lot of doctors in urology, is they usually are a little bit better sometimes than the radiologists at finding those little tiny microscopic stones. And believe it or not, a little tiny stone can cause a lot of pain and discomfort. So I've had that happen at least twice now, where the radiologist said, no, there's nothing going on. And when I saw my urologist, he actually saw the stone. So maybe, as AI helps and support, and I don't see this taking over. I actually see it more as complementing. Think of it kind of like a co-pilot. Like, let's have the radiologist read it, but then a second read could maybe be done by AI. And as mentioned a second ago, the studies so far is showing that the AI machines are doing about a 2% better job at detecting and picking up early stage disease. So not significantly better. And also, if you look at some of the radiology data that talks about why they oftentimes miss, a lot of times it's just they're distracted, right? So where the nice thing about an AI machine, it doesn't care about distractions. No one's, sending in a text message or noise in the background, things akin to that could cause a distraction. And again, this is nothing new, but I credit urology for being one of the very first to really introduce robotic assisted surgery. In full disclosure, that's my doctor. He's a great urologist here in Atlanta, Dr. Patel. He's also one of the more, what I would consider, innovative doctor, always trying new things. And so very proud to call him my caregiver, my doctor. And he's obviously one of our, cutting edge urologists here in Atlanta that we oftentimes look to for guidance on things like this. And then you are seeing, there is no specific AI powered EHR yet in urology specifically. However, many of the EHR vendors, Epic in particular, Athena, Allscripts, NextGen, they're all chasing AI enhancements. The main thing that are one of the newest features that is in some cases already out is this concept called ambient listening. And I have mixed feelings of that. Actually, I'm probably okay with it, with the caveat that as long as we're giving the consent to the patient. I think if you're going to record someone, or if there's recording going on in a building or in an exam room, you probably owe it to the patient to at least let them know. And by the way, it's not uncommon for patients to bring in their phones set to record. They record caregivers a lot of times without your knowledge. So I think it could help. Like how many times have you had a situation where you didn't say that, and the patient's back there saying, or online writing something saying this is what you said, or they just didn't follow instructions, or worse, there's some malpractice claim that comes later, and this recording could very much help the provider and caregiver sort of defend exactly what happened. And the other big advantage is sometimes these computers are not just listening to carry out orders. There may be things that are important to the doctor that the patient just doesn't know to communicate. For example, you're getting ready to prepare a patient to go in for surgery. You might ask the question, are you on blood thinners? Well, the patient may say no, because to them, they're not. But the data shows, based on LexisNexis, that they just ordered some fish oil from Amazon. So that could be helpful information to say, well, our monitoring system detects that you've ordered this. Are you taking it? Well, no, that was for my husband. So it does help in that it can fill the gap in between trying to collect a lot of information, a very short period of time, and oftentimes dealing with an incomplete amount of information. And from what I've seen, these listening devices actually are able to go in and in real time, you can see it with your own eyes. It's populating the note, triggering the orders, handling some of the next steps that may have otherwise been done by the staff that would have had to take place after the patient left the exam room. So I think this is starting to show some real benefits. And I'd be curious, of course, I'm not able to ask for a show of hands here if anyone's tried ambient listening or not, but that's probably the thing that I'm hearing of talked about the most, and that's probably the thing that I'm seeing to be most beneficial and impactful that's ready right now today if your vendor supports it. AI powered collections. This is another great tool that these apps are now able to go in and really figure out, based on a number of data points, the propensity for a patient to likely pay versus which ones may need more intervention. Because we oftentimes approach collections as a one size fits all, but when you get into different payers, different rules, different demographics related to the authorizations that may come from this plan versus that plan, sometimes these tools are now able to predict before the claim even goes out if you have all the complete elements based on that plan. What I really like about some of these tools is that you can actually feed it your expected levels of reimbursement. So when the check comes in from the payer, it calls back to the AI and says, did I get paid correctly? And if you did get paid correctly, the AI actually can go out and seek the recovery of the difference and start that process. So not to scare anybody in the back office, I don't think it's going to replace bill collectors and our billing team anytime soon, but there is a lot of innovation being developed to help practices do a better job at collecting. And if you think about this area of your operations, this is oftentimes where you do have a lot of turnover. It's hard to staff. It's hard to find good skilled labor that knows how to all the ins and outs because it's complicated, right? These payers have created, millions of rules across hundreds of payers, and we're just supposed to know. And oh, by the way, they get to change them every year. So I think that's one of the benefits that AI can probably do a better job at tracking and remembering, all these rules and all these circumstances. You heard me say earlier about help desk. We're seeing this. We've for years have helped practices, but now we're seeing the bots do a lot of what we used to do by remoting in, which I think is a good thing. It's okay to embrace this. If you can get faster support, 24/7 support. The best thing about the bots is they don't call in sick. They never take vacation. They don't complain. They don't even take a lunch break. Like, they work like all day long, and you don't even have to pay them a salary, or benefits that matter. So I think it's a good thing if you can find it. You may have heard me mention earlier, I think I did, call centers. We're also going to see bots take over call centers. I think we'll see bots take over all things related to patient statements and inquiries, at least the first level, maybe even second level inquiries, and it could go. I think we could even see bots handle prescription refills and non-urgent messages, returning messages that's kind of based on a standard of care. In fact, the next slide, I think, shows you exactly how it would work. So think of, I don't have my pointer, but on the far left, you see these little red dots. These red dots illustrate what I would call the input. The green dots illustrate what is often known as the output. So let's say you have a bot doing just a garden variety patient intake. New patient just comes in, and normally they're filling out paperwork or someone's asking the questions, and then someone has to rekey it into the EHR. Well, the red dot may just be a standard question of, do you smoke? And if the answer is no, it passes all those green dots and goes to the next one. If the answer is yes, then you can see where the green dots now have to explode in. And now it's like, okay, well, how long, how much, how often? So as these bots navigate the journey of a conversation, it's firing off sort of what I would call if and do what type algorithms. And I don't know, I guess it takes just a lot of time to build this, but when you think of a natural conversation and all the dynamics that could occur Same scenario. But let's try this different way. Do you smoke? Yes, I smoke. How often? Well, a little bit, and I do a little crack on the side. Wait a minute. What you do? What? Now you're dealing with a whole different set of questions. So where's the green dot for now substance abuse, right? Because the patient just threw something at you that wasn't even built into this decision tree or discussion tree. And I think that's where some of the challenges are. So as you start thinking through your expectations of a chatbot, just know that it's only able to respond to whatever is built in based on the standard responses that a person would normally give. But it's healthcare, right? And we're humans. We don't always give the normal responses. And there could be a set of circumstances that just completely break the normal. And that happens a lot in healthcare. You see it all the time. Urology has some of the most interesting conversations I think I've ever witnessed in any specialty. So yeah, you're going to break it. And I don't think the chatbots fully know how to respond in all those dynamics, but you can clearly see in this example, there's a lot of little green dots that are trying to predict how to respond based on the input. So you have inputs and you have outputs, and the outputs are always going to be much more dynamic and robust than the inputs. Hopefully that helps. This was when I saw this at a presentation, it actually gave me the visual of, how the technology is working behind the scenes. And then, this is a good one. So what do you guys think about this? Facial recognition when you walk into a practice, like the patient walks in, you have a camera, knows who they are, checks them in. We just talked about the bot, but now the facial recognition says, hey, I can handle this. I know this is Jeff. He has this insurance. He's always late. So let's send him a notice to remind him they needs to come in, 15 minutes early next time. And they know that I owe a balance. And so they're going to, automatically ask me to stop by the front desk to have that discussion. A little creepy. I agree. Yeah, that's concerning. Again, I think I can live with this as long as we're probably giving consent to patients and consumers that it might be occurring. Another thing is not related to healthcare, but the FBI has been using this for some time to try to recognize dangerous people. We know who's on the most 100 most wanted list. We know who they are. We actually have their pictures in many cases. So think about fighting crime or fighting terrorism. I mean, what if the hotel you're staying in had something that could detect when a dangerous person walked into that building and, could set off alerts to security and whatnot. So I think this is helpful. At the same time, it can be intrusive. It can be an invasion of privacy. It can be something that's a little bit unexpected at times. I've actually had, I would call them kind of strange scenarios occur. I've been at Home Depot before, shopping for a faucet, and I get an ad for a faucet on my phone. Now, I think it's a combination of a couple things. One is my phone is probably broadcasting my location, and Google already knows that I was researching a faucet. And so the system put two and two together, and maybe they hit me with some facial recognition, and they know I'm cheap. And so they just hit me with a coupon. So they knew three important things about me by stitching together my location, my internet search history, and a profile that they already had on me based on my spending habits. So you can sort of see where, yeah, that kind of stuff gets a little bit unsettling, right? But I always remind myself that, if you want to know where the nearest Starbucks is, you sort of have to give up your location. So there's always that trade-off. And then let's talk a little bit about kind of the ethical concerns, right? Because I do think that this is something that our industry does have to address, and they probably need to address it sooner than later. There have been examples, most recently with Google, there's gotten a lot of pushback about if there's bias, or even some instances there's been AI that's acted in a racist kind of way. If you want to entertain yourself, well, maybe you shouldn't Google Microsoft Tay, but that was a highly offensive chatbot that went on rants that it should have never went on, and no one can figure out why all of a sudden it got so racist, but they had to take it down. So it does happen. I also think, as much as you want to not have your bias be put into your code, I could see where that can easily be done, even if it's unintentional, because the computers are trained by the humans and the beliefs and that they may hold. So if a developer holds certain biases, that certainly can. In fact, I've not seen a major example of this. Well, there's several little ones, but a major one recently in the court system. Judges were using AI to sentence people, and the AI would tell them the likelihood of that person being a repeat offender. And if the AI said you were higher probability of being a repeat offender, the judge would do what? Harsher sentence, right? They would send you to jail longer. Well, for some crazy reason, people born in October were more likely to be repeat offenders. So if you were unlucky enough to be in front of this judge with a birthday in October, you were being sentenced to more harsher sentencing. But it turned out it just happened to be no correlation. It just happened to be that the sampling of data just had people born in October more often than other months, and the AI was using that. So sometimes you can have some pretty serious defects that can have consequences that's unintended. What happens if AI goes evil, right? Like it can cure the cancer just by simply killing us off, right? Like that's one way to do it, but it's not the best way. And so what happens if it hurts a patient? Can it have rights? That's an interesting question. And you might say, well, no way, it can't have rights, but corporations have rights and they're not people. What about just basic humanity, right? Should we be doing this? Is it good? I will tell you that I remember when, it's been a minute, but I remember when Facebook first came out, my initial belief was it was going to bring positive ideals together and would unite the world, and we could spread positive things because it was this platform that we could all be connected no matter where we live. Well, look at what it's done now, right? It's become echo chambers. It's used to incite violence. The data clearly shows that our kids and young adults are having more depression because of what they see on social media. So again, I think we really need to think through whether or not, from a humanity standpoint, if it's in our best interest to just hand these things over to the computers. If you go and develop AI with a vendor partner, well, who owns the AI? Who owns the IP? Whose product is that? Especially if it starts to evolve down the road. What happens if it's defective and it causes you to make a mistake? Is that the machine's fault, or is that still your fault? The rule right now, good or bad, is that the provider is still ultimately responsible, even if the machine is defective. What if it starts predicting how to treat people differently? That could be a problem, right? Like, let's say, remember the AI collection tools I was telling you about? Well, what if it figures out that a certain population of patients is just because of their social statuses or maybe their zip code that they come from? Oh, people that come from that zip code are never able to pay, therefore let's treat them differently. So you can sort of see where that can cause problems. So again, I think these are kind of concerns that we're going to have to unpack and deal with. Security, right? We talked about, whether or not it's safe, whether or not we should have consent, what are the limitations, how much data, and of course, patient privacy. So there's a lot of concerns here that still have to be addressed, in my opinion. And then as you start thinking about adopting it, the last thing I would do right now is go out and buy anything. I think you're doing the right thing, getting information, creating awareness, understanding the limitations, understanding where you sort of fit in. I will say that if you're thinking about doing anything AI related, the fundamentals to this is going to be highly predicated on the integrity and the quality of your existing clinical data. So if right now your EHR is outdated, not structured, a lot of unstructured text, or maybe you're scanning in documents, no real strategy around how you're going to archive the data, store the data. I don't want to use an outdated cliche, but garbage in, garbage out. So if you layer in AI, you can already see where it's going to be a problem for you, because it's going to be fed with, maybe even corrupt data or incomplete data, and you won't get the outcome that you're ultimately looking for. So data quality and data integrity built on a modern system that can be compatible is going to be very key. So that's one of the things when clients ask us or tell us that they want to get into AI, I'm like, let's first make sure that the foundation, because more times than not, you need to fix that before you start anything related to AI. As you start thinking about how you want to implement it, I think, awareness, education, looking probably first, if I was still a practice administrator, before I would go out and purchase, I would see what's best aligned with what I already have, unless you just plan on replacing everything. A lot of vendors today have what's called marketplaces, and they're putting products that are already compatible with their solution. For those of you who may not be industry junkies like myself, when the Cures Act was published or passed, they forced all the vendors to publish their AIs. So here's something cool. You can now get, APIs, the programming language. So if you, the practice, want to develop a patient-facing app, for example, you now have the APIs. And in the past, vendors would charge a lot of money for that, or they just flat out wouldn't give it to you. Well, now they're required, if they're going to be considered a meaningful use certified vendor, they must provide their APIs. That's why we're now seeing a lot of applications that work with your existing, technology platforms come to market. Where to start? Every presentation has to have at least one slide devoted to the 10-step plan. I tried to make it 3, but unfortunately I got to 10. So I think, like I said, doing right thing now, you're learning, education, create awareness, help embrace it. I would encourage you not to fear it, even though there's lots of unsettling things about it. But I think we're going to have to confront it and embrace it. Start educating your leadership, set expectations low, identify some easy wins, build, there's no downside in improving the integrity of your data quality now, not just for AI, but for reporting, for MIPS MACRA, for, maybe negotiating with payers, because you can now show you a better outcome, for enhanced reimbursement, optimization. All those things can actually benefit the practice. Another big tip that I strongly recommend, if you're still doing an on-premise EHR, that's where your server is in your office, maybe sitting on a floor somewhere waiting for the flood, that's probably not going to get you there. You're going to have to embrace cloud computing, because a lot of these AI machines are now crowdsourcing, leveraging the power of the internet. There's no way we're ever going to put the horsepower, the computing processing power in our closets at our office. You're going to need much more advanced computing processing, and that's only going to be achieved through unless you just want to spend millions of dollars, which most people won't do that. I would recommend a work group to start studying it, look at gaps, and then consider, I certainly enlist a third-party expert if you need, a little bit of guidance as you go through this. Where I think a third party can help you is on the vendor contracting piece, because I do think where I see practices get in trouble is they just flat out buy stuff that doesn't work or is defective. And now what do you do, right? Do you get your money back? How do you hold the vendor accountable? So that's always my big concern. If you are going to work with vendors, ask about who owns the license, who owns the right. Do you get royalty agreements? Always want to have what's called an acceptance criteria that says, hey, I'm accepting and embracing this, but I'm not financially responsible until things work as promised. And it may be work as promised is some sort of co-development agreement where you work on it together. And then at that point is when you accept financial responsibility, because you may be going into something that's not fully baked just yet. And you may find that, hey, even despite the best of intentions, it just didn't work out. Do you have plans for how you would terminate from an AI app? Like, what happens then? Who controls the data? What happens with all the things it learned? Do I get that back? Can I shut it down? Do you protect me from other people using what I built? Because I was wanting to build something unique for my practice. What about things like governing law and venue? If there is a dispute, we'll settle this in my state, or do I have to go to the state of the vendor? So, and price escalation, that's another at the last bullet on the left. Keep in mind that if you were to develop something very innovative that had a lot of market usability, suddenly they may start increasing the price. My hopes for you as an early adopter would be that you have price protection and that you'll prevent them from just going up and up and up on you. We saw this in early stages of EMR adoptions. Vendors wanted to get in the market. They cut low, good deals. Prices went up. And then all of a sudden, practices were faced with 5, 10, 15% price increases. Other considerations, look at short-term things we talked about. I think medium could be sort of testing the water. And then long-term, you're probably going to need to start thinking about how do you invest in your infrastructure, the data quality stuff that we talked about a second ago. And then, some real world examples. These are a few that are around the country. My favorite one, I think it's up here. If not, I can just describe it to you. It was actually Wake Forest, where they launched. They had challenges with, for some reason, supplies would just go missing, and they couldn't get them to the department's big campus, and so they had deployed drones that could pick up small packages and fly them around the campus. And so, literally overnight, they eliminated all the couriers that was running supplies everywhere. But more importantly, suddenly they had no more leakage. Right, the supplies actually got from the supply house or the supply room to the nurse or to the floor. And specifically, they were finding that some of the meds and things like that were just not out of inventory. And so that was a good example. And then more recently, Oshner, if you're in Louisiana, was doing a project with Apple with their behavioral health, where the Apple Watch could call back to a caregiver and say, hey, this patient hasn't moved in 3 days. Let's go check on them. And so there are a lot of innovation around that. So, I think we're going to see more of our larger institutions spend the money, hopefully, and maybe they'll do the trial and error for us for a minute to help refine it, develop it, and then you'll start to see a lot of this innovation come down market as the big health systems play around with it. And then I always like to have at least one final thought. Many of you are probably familiar with the book, The Black Swan. The Black Swan is a great book. It talks about the devastating consequences that can hit a practice, or any organization for that matter, that doesn't prepare for the future. And the one example that the Black Swan gives that I think is just catastrophic is what happened to the Kodak Corporation. Remember Kodak? Like a global billion-dollar worldwide company. And the executives at Kodak believed that there was no way possible that digital cameras would ever replace them, because they knew people would literally go into burning homes to get family photos. And that was true. But how many people actually process film today? There's a big difference in my two kids' age. The older kid, we got boxes and boxes of photographs. The younger kid, not so much. But thankfully, they looked very similar when they were younger. So we just tell the younger one those are her pictures. So she doesn't know the difference yet. But no, all joking aside, Kodak didn't see it coming, and they had a black swan moment. And so the one example I want to give you as healthcare administrators and people that work in doctors' offices, I thought this was another great example. They was comparing food consumption over the lifespan of an animal, and they were figuring out that the longer the animal lived, the more food the animal consumed. And you're probably asking yourself right about now, Jeffrey, how are you going to correlate this? Because now you just went from Kodak to an animal eating more food over time. Well, trust me, there are devastating consequences coming to this animal, and I think you'll be able to relate to it. And the consequences are this right here. Now, did the turkey not know? Like, there's all this free food, friends are leaving, they're not coming back, there's all this screaming in the background. And the point of sharing this with you is, let's not be turkeys, right? Let's have some awareness. The noise around us is not noise. We need to pay attention to it, and we need to start planning and preparing. And a lot of times, just a little bit of action taking can oftentimes position the practice to be very resilient in the future, where, oftentimes when we see practices struggling, it's not because they didn't have the capability, the know-how, the knowledge, they just didn't plan for the future. And so I think the good news is you have that opportunity. You're doing the right thing by attending presentations like this. You're learning, getting education. I'm grateful for the AUA for putting on talks like this, and there's many others. If you haven't done so already, please, look through all the education. It's a great service they provide with a lot of great speakers. So I'll leave you with this final slide, which is just some resources that you can go to on your own and get more information on AI. And as always, it is such an honor to present. Hopefully you enjoyed this. I'm looking forward, hopefully, to seeing everyone in the future at one of the in-person meetings. But in the meantime, thank you very much. If you have any questions or comments, as always, feel free to reach out. Thank you.